Okay, so good morning. Thank you, Lisa. That was great. Thank you for answering all those questions about Medicare. And so now we'll just move on to some ACA questions. I had sent out an email earlier this week or last week, and I had gotten some questions via email. So we'll try to address all of those, but feel free to just jump in anytime. I want this to be a discussion. So if something comes to your mind, just jump in and let's try to get all these questions answered. So I know the big question is, when will we see the rates? And we addressed that a little bit in the previous session that we just don't know. It may be, that last day of October before we get to see those rates. And it's really the same situation with those enhanced tax credits. We just don't know right now what's going to happen with those. So we really can't answer those questions, but we will talk about those a little bit more. So I know Robin said she might have to jump off earlier than 10. So I wanted to go ahead and let's ask Robin questions first. So these were some that I had already gotten. Robin, what about the out of state cost? That's a question I get a lot even throughout the year and that some people aren't aware of. Even if an out of state doctor is in the network, there's still going to be an out of state cost. Can you just talk about that a little bit?
Yes, ma'am. Well, and it also is plan specific. Not all of the plans have higher out-of-pocket cost out of state. Like your ones with your least amount, there's obviously no out-of-state higher out-of-pocket on a standard Blue Sabre Bronze. Your value silver, your value gold have the least amount of difference out of state. I'm trying to pull up an example now, just to kind of give you guys an idea, but usually it's more surrounding the standardized plans, the select plans usually have a higher, even if that doctor's in that Blue Card or that nationwide network, it may have like a higher out-of-pocket cost. Usually it's things like a specialist visit, an office visit, hospital procedures. I'm trying to pull up, just kind of give you guys an example now. I'm sorry. We are a little slow today in our system. So let's see.
I know some of us work on, close to a border state, and we help people that have doctors in a neighboring state. And so if that's the case, we really need to look at those plans carefully and make sure we get them in a plan with the lower out of state cost. Is that what you would suggest, Robin?
Well, and it's usually, like I said, value silver, value gold are going to have the least amount. Bronze, the Blue Sabre Bronze doesn't have a difference. If they are out of state a lot, you definitely want to look at the plan a little closer. Just if we're going, especially in the mid grade plans, because most of them will have something that will be a higher out of pocket out of state. Again, I apologize. I'm trying to kind of give you a good middle kind of grade answer. I was going to look at the blue value silver right quick just to give you an idea. I don't have them. I'm sorry, I don't have them all memorized.
No, it's too many. I get it. I'll always have to look at those summary of benefits to know for sure. And while you're pulling that up, another kind of bouncing off of that same out of state issue, I know I've run into this. We're right on the border of Tennessee. Even if someone lives in Tennessee and all of their doctors are in Alabama, they are still not eligible to sign up for a Blue Cross of Alabama plan. Is that correct too, Robin?
Correct. It's got to have an Alabama address. That's what they're looking for.
Okay.
And just to give you an example, like Blue Value Silver, and this, of course, is base without any cost-sharing reductions. Even if the doctor's in the network, a specialist out of state will have a $180 copay. A primary care doctor out of state, even in the network, will have a $50 copay. So just to kind of give you some ideas of why, if they're going to the doctor a lot over the state line, then you definitely want to make sure to be very careful which plan that you choose. Because even if in the network, unfortunately, they're going to have a higher out-of-pocket cost on certain services on a decent number of the plans that we offer out of state.
Thank you. That helps clear that up. And so another question that I wanted to run by you that I wasn't 100% sure about. So I know, which plans, we've talked about that a lot, require a PCP designation of a primary care doctor in the select network. But I had this question. If someone doesn't pick one, will Blue Cross just assign them a primary care select physician?
No, they will have no benefit.
Okay. So those
We
plans will not pay anything unless that person the member chooses a primary care doctor, or we help them and we send in that designation form. Blue Cross will not assign one to them.
No, we won't. And now they may, of course, they should have, except for, I believe, yeah, well, even with the EPO options, they should still have medical emergency benefits as long as it is truly a medical emergency. Going to the ER on a Tuesday at 10 a.m. for a flu, the hospital's most likely not going to classify that as an emergency visit. So then that would process out of network or non-covered, depending on what plan that you have. But if you do not designate a primary care physician and the plan requires it, they typically will have no benefits other than a medical emergency benefit. Think of it like your new credit card in the mail. You got to call that number to activate it. It's essentially like that. And there's typically no backdating of the PCP. So if a customer says, well, I forgot, can you backdate it? Or if one of y'all reach out to me, I can enter. I'm the one that actually, that PCP link, designation link that y'all use, that goes to me. So I'll double check it and make sure it's a valid provider, and I'll enter it. If I can't enter it, I usually respond back and let somebody know why I can't enter it. Maybe the contract hasn't shown up yet. I can have one backdated, but it has to be, there's a small window they've given me to have those backdated. Like we had one recently where the marketplace took a long time to set the plan up. They set the plan up on the evening of October 7th is when the download came through. The PCP request had come through on the 4th. I had responded back. I'm holding it. No contract has shown up yet. Well, October 8th, they went to the doctor. And then, of course, I saw the plan on October 9th, added it back. No one had mentioned they had went to the doctor. So their October 8th claim denied. But because I had that request in prior to the services rendered, I was allowed to go back in and adjust it. So there are some scenarios where I can do that, and so if it ever comes up, feel free to call me. If I can do it, I'm gonna make sure it happens. And if maybe there was, like, if the agent says, well, I was supposed to do that, I forgot to do it, or I got it in late, depending on the circumstances, can take it straight from the agent. I don't ever have to speak to the customer though. Depending on what it is, I may or may not be able to backdate it. Referrals, I cannot touch. So if it requires a referral and they don't get it in time, I have no juice in that department to get that backdated.
Thank you. Thank you for clearing that up. And so another question that I get a lot, and I've got some slides so you can see exactly what I'm talking about, is this phrase, deductible does not apply. So here I've screenshotted these frequently asked questions about the Blue Value Silver. And so we see that the overall deductible for an individual on this plan would be $3,700. And then we also see that some services are covered before the deductible is met. And so that's something I want to really point out because I get a lot of questions about this. So, Robin, here on the primary care visit where it says deductible does not apply, I'm afraid sometimes people haven't read this sentence up here at the top. And so will you just talk about how if you see this deductible does not apply, how that needs to let us know that that would be before the deductible, but that cost doesn't go toward the deductible. And then we'll talk about the ones that don't have that phrase in a second. If you'll just touch on that a little bit and try to clear up some confusion on that.
Yeah, there have been some questions that if it says deductible does not apply, do they just go straight into a call share or copay, depending on obviously what the services are? If it says deductible, not all services on every plan are going to be subject to the deductible. Like our Blue Saver Bronze, you get a couple of doctor's sick visits where you just pay a copay before you have to meet the deductible. But if you will not get credit towards the deductible, that seems to be a popular question. You will not get credit towards the deductible if that does not apply to the deductible. So just because you paid in copays or coinsurance more than what your deductible is, if those services did not require a deductible, then when you finally have something done that does, it's going to take the deductible. Now, you will get credit towards your out-of-pocket maximum in network for that deductible, but your copays, cost sharing, they also go to your out-of-pocket max, but they're not going to help you meet that deductible if that particular service doesn't apply to that service.
Thank you, Robin. And another thing I want to touch on this plan. Now, let me point out, this is the Blue Value Silver. And a lot of times we tell people, well, your doctor doesn't have to be in that primary care select network, and it doesn't have to be, but be sure that you notice over here, if they don't have a doctor in that select network, they're going to have a $50 copay. And then on getting a referral, if they don't have a referral from a primary care, it's going to be $90 instead of $70. And then here's where Robin was talking about that outside of Alabama in network, it's going to be a $180 copay. So just be sure you read this information over here to the far right. And Robin, do you want to add on anything else about that?
I apologize. I was answering a message to a rep that's on a live call, so I missed part of that question. I'm trying to multitask. What
No
was
problem.
that? I'm sorry.
No, I was just pointing out that, if we've told someone, okay, you can get on this Blue Value Silver, which is the plan here that I have pulled up, and they do not have a doctor that's in the select network, instead of the copay being $10 for that primary care visit, it's going to be $50. And then
Yeah, you're going to pay the higher cost share. I'm sorry, I didn't mean to cut you off. I have a little bit of delay on my end.
No, that's perfect, Robin. And then I was just pointing out also about the specialist, if they don't get a referral, if they don't have a select primary care doctor, then that copay is going to be $90. And then I also pointed out here about the outside of Alabama in network. Even though it's in network, it's going to be a $180 copay. So
correct.
So, just be sure when you're helping somebody and you're going over this, that you don't just ignore this side and look at this, because this is important to read all of those. So all of these things would be paid before the deductible, but let's look at some things that might not would. This is still on that same plan. So I wanted to point out, particularly on the drugs, if someone's on a tier 5 drug, you do not see that phrase deductible does not apply. And so, Robin, here in this case, if someone's on a tier 5 drug, will you explain to us what's going to happen if they go and fill that drug?
So when the pharmacy runs that medication, the system's automatically going to check. It's direct linked into our system. So I'm actually going to check and see if that deductible has been met. If it has not, unless that medication is more than what's left on your deductible, you're going to pay the full contracted rate of the deductible. The system's going to apply it. So if you've not met any of your deductible and you go get the medication is $300. And the contracted rate, let's say, is $200. Pharmacy writes off the $100, you pay $200, we apply that to your deductible. Next time you go get a medication, maybe you've got you've got all this that you've already gotten, whether it be a doctor's visit or a prescription, subject to that deductible. You go to get that tier 5 again, or like in this year, like a tier 6, then it's going to show that you've already met portion of that. And if, let's just say you've got $100 left on your deductible and the medication is $200. You're going to pay The $100 for your deductible, you would pay $150 if it's, let's say, a tier 6, which is 50% subject to the deductible. You're going to pay the other 100, and then you're going to pay 50% of what's left, which is another 100, so 150. But that's, again, only if it's, subject to the deductible and the deductible had met. The system automatically calculates that. There's nothing you have to keep track of. There's nothing the pharmacy, when they run that medication, the system's it's a live pharmacy system. It's going to see anything that's been applied to your deductible. The only time it won't is, let's say you had a big procedure done on the medical side, and that's going to hit your deductible, but maybe that claim hasn't processed yet. So you go to the pharmacy trying to pick up a tier 5 this year, a tier 6, that is subject to the deductible. You think your deductible's been met, and then the pharmacy says, no, it doesn't show your deductible been met. So that's something that can happen sometimes if you have services real close to each other where one hasn't, maybe the claim hasn't processed yet. So if you pay a deductible, let's say that happens and that medication applies to the deductible because that claim hasn't processed on the medical side yet. When that claim on the medical side goes to process, it'll see what's already been applied to the deductible by any other service or medication, and it will cut down and won't as much be billed back to the doctor to say, hey, this much applied to their deductible. Sometimes if they know it's going to apply to a deductible, a doctor will ask you to pay a certain amount up front. If after that claim resolves, you didn't owe that much based off what we sent to the provider would be the one that would reimburse you any overpayment. So I just kind of want to throw that out there because I've seen that happen over the last couple of months where they thought the deductible was met because of a medical service, but that claim had not finalized yet. So it won't count towards the deductible until it finalized. So just wanted to bring that up.
Thank you, Robin. So I hope that clears up about this phrase, deductible does not apply. But as you're helping people with these plans, be sure that you look for that phrase so that you'll know what would be paid before the deductible and what wouldn't be, because we don't want people to be surprised with some charges they weren't expecting. So thank you, Robin, for helping clear that up. Okay, so here was another question that I got. Does a bronze HSA plan cover name brand drugs? And it does. I mean, there are some that are covered, but you always need to check the formulary for the drug in question. And then you also will need to check to see if it's covered before the deductible's met, because I have noticed on some of the bronze plans, anything, I believe above a tier 1, you have to meet your deductible first. And those deductibles are pretty hefty. So you would, if someone's on a name, yes, Robin, jump in and talk about that a little more.
I apologize. I don't mean to cut you off. I did want to make note that the HSA bronze plan does not have any medications that are not subject to the deductible, and that's because it's an HSA plan. You're really not supposed to have first dollar coverage under an HSA option.
Okay.
So the bronze, now the regular bronze, yes, but the HSA bronze, all of the medications are going to be subject to that medical deductible. And of course, that base medical deductible on the HSA bronze plan for this year is $7,200 for self only. So
okay,
just keep those tiny differences in mind. That's all. I just wanted to bring that up, that some of them, that your HSAs, most of the time, all your meds are going to be subject to that. FYI, I'm not sure if I'm supposed to tell y'all that yet. I'm going to throw it out there. The gold HSA is going away for 2026. Those customers who have it will be migrated over to the HSA bronze.
Okay. All right. Well, that's good to know. So that's probably why some people feel like that the drugs might not be covered, because I've had an agent say, well, they say, or this person's told me that the drugs aren't covered, but it's just that they have to meet that deductible first on that specific bronze HSA plan. So it may feel like they're not being covered because they're paying full price until the deductible is met. Is that correct, Robin?
Yes, I do want to add in, though, that if it is on the formulary, it is a covered medication. When they run it, it will be approved. If that medicine is a reduced medicine, so $500, but the allowed amount is $300, they might have to pay 100%, but it's going to be the $300. not the additional 200, because they get the contracted rate even if it's subject to the deductible, as long as it's an approved medication. So they won't necessarily still have to pay full price in those scenarios.
Okay, well, that's good to know. Okay, great. And remember, if anybody else has a question, just jump in. So here's another question that we've been hearing from people that, just even people that are on ACA. Are the subsidies going away? Okay. No, not all of the subsidies, but those enhanced subsidies are set to expire December 31st unless Congress acts. So let's talk for a second about what that's going to mean. If you look here at this, FPL chart, that means that people over this 400% will no longer be eligible for a subsidy at all. So if a single person makes $1 over 62,600, then they're going to owe their entire subsidy back. So when you're helping people enroll, you really need to have this chart in front of you. And if their income is near this 400, then you need to make them aware of that they're right on what we call that cliff, and that they could be in danger of paying back the entire subsidy. And then here you also have the contribution limits for each, level of the FPL. And notice that over 400%, there's no contribution limit there. So, there's not going to be a cap on what that person might have to pay. And I've already looked at what some of those might be, and it can get very pricey. Does anybody want to add anything to this or ask any questions about this? It's going to be very important. Okay.
Heather, can you send us this chart?
Yes. Okay. Say that one more time. I was.
Can you
not...
send us this chart? I'd like to have this chart.
Yes, sir. Yes, I sure will. And I also included it in that ACA handbook, but I will send
okay.
but I will send this out also. I'll send you, it's a very good chart to have. So I'm making myself a note to send that out when I send out the recording of this. But it's going to be extremely important that people that are close to this understand that they're in danger if they go over that by even $1 of paying back the entire subsidy.
Question.
Yes.
So what are the people going to do like this year that are already receiving a subsidy, and so all of a sudden they're just not? Do they get a letter? What happens?
Okay, so first of all, if someone's been enrolled for 2025 and they've made over this, they won't have to pay that back. This would not really go into effect and affect someone on their taxes until they file their taxes for 2026. So be sure of that. What's already happened this year, someone's not going to be penalized because this wasn't in effect yet. So, but I think what you're asking, Lisa, is will people be notified? And Robin, I assume that Blue Cross is going to send out some letters pretty soon informing people of what their new premium's going to be without the enhanced subsidy. Is that what Blue Cross is planning on doing?
We are that is what's in the talks, depending on what happens with all of this in the government situation. They have their hand on the trigger to type that up and send it out as soon as everything is finalized. The customers that would not, from what we can tell, be affected, my understanding is letters are supposed to start going out most likely next week if we don't believe that they're affected, but it's going to have verbiage in it that this is going to be your base premium for next year. This does not include any subsidies or assistance that you may qualify. So they're going to get the base premium letter, and it's just going to tell them if we don't know what that subsidy, if we have not been provided that information from the marketplace yet, then it is going to have verbiage that subsidy is, I apologize, somebody's trying to call my phone, but that subsidy is not, or that premium is not including any subsidies they qualify for. If they get that letter, they may freak out when they see that base premium because a lot of people don't really understand how much their insurance really is. Just reassure them, you can either reach out to me to see if a subsidy information has been sent over for them, or, they're welcome to call customer service. They can check that as well and see what that future subsidy is, or see if they're affected and they're not getting one sooner than later, hopefully, because that way it may be a situation they simply need to update their income as well. People forget to update their income, and sometimes it can help them.
Yeah, okay. I was wondering about those letters, so I'm sure we'll start getting a lot of calls when people get those letters.
As soon as I know that they're going out, I can send you something so you can let everybody know.
Oh, that would be great, Robin. Thank you. Okay, and so we're running a little short on time. So I've also gotten quite a few questions about what is an HSA, and that is a health savings account, and that's something that you will probably be a little more popular this year, just given that the cliff may be coming back or probably is coming back. But a health savings account can offer a triple tax advantage. Okay, what they put into it would reduce that modified adjusted gross income. So if someone's right on the border of that cliff and they're enrolled in an HSA compatible plan, they could contribute to that HSA, and that amount would come off of their income, and that could help lower that so that they would be eligible for a subsidy. And so that would be better, it'd be better for them to put that extra money into a savings account that they're going to be able to use instead of just paying extra, and not getting a subsidy, paying extra on their premium. So that's one thing you may want to think about if people are close to that cliff. And another thing about HSAs that's going to be new for 2026 is all of the bronze and catastrophic plans will be HSA compatible. And Robin, do you have anything to add about that and about which plans will be HSA compatible? Or I guess do you know if any other than the bronze and catastrophic plans will be? Or we'll just have to wait and see on that. So on my previous webinar, I had listed what would qualify a plan to be HSA compatible in 2026. So you could go back and look at that. That was the ACA Changes webinar that I did last month. So you may want to look at that. But all the bronze and catastrophic plans will be HSA compatible in 2026. And you're going to see that catastrophic plan come up more because now it will be available for people over 30 as well. And the application will help determine who's eligible for a catastrophic plan. So you won't have to worry about figuring that part out on your own. And if you want to learn more about HSAs, I've been getting a ton of questions about them. Here's a link to the HSA Store Learning Center. It's got a lot of information. And then Fidelity. And that's who I refer people to set up the HSA. They can do it online and it's super easy. So if you want to know more about HSAs, when I send out these slides, these are live links. And then another thing you may want, with the premiums going up and people getting less subsidy, more people may enroll in those bronze plans. And so in addition, you might want to talk to them about an indemnity plan to help cover some of their out-of-pocket costs, such as if they were in the hospital. A hospital indemnity plan could just give them a lump sum of money to help them meet their deductible or even their max out-of-pocket. And the one that I usually use is Manhattan Life. And if you've not been contracted for an indemnity plan, this is a link to that. You can jump on there and get that going so that you would be able to offer that to help your clients as well. And then Health Sherpa has got some great tools to help us. And actually, they're having a webinar this afternoon at 2:00, I believe. And so if you want to get on your Health Sherpa and sign up for it, I don't think it's too late. But this is a link to the Health Sherpa's Agent Action Plan. It's got some good ideas. and then this renewal pathways link. You really want to look at that, because one thing that I've seen that I like is a bulk email. And once the plans are out and open enrollment begins, you can send it out before, but it's not going to have a link to the plans where they can compare the new plan. But if you'll click on that link and read about it, there is a way that when you send out the email, then the consumers can click on it and they can see the plan they're enrolled in for 2025 right beside of the one for 2026, and they can compare those, see if they want to stay in that plan or if they want to shop for a different plan. They can also update some information, using that link, that email link that you've sent them. And so I think that would be a way to save us a lot of time to use that link. So look over those, make sure you're familiar with those renewal pathways. Now, there are going to be some people that are going to be priorities that you want to be sure that you reach out to and talk to. And if you go from your clients page and you click on renewals, and then you come down here to renewal follow-ups and you click on that drop box, you can sort out people that are close to that 400% of the FPL, and you're going to need to reach out to those people and explain to them, if these subsidies are not extended, these enhanced subsidies are not extended, then you're going to need to explain to them that they're really close to that cliff and what's going on with them. You can also sort for people that have had a zero premium in the past. Okay. They're probably not going to have a zero premium again. So it's going to be important that you reach out to them and make sure they're aware that they are going to have a premium and that Blue Cross will need their payment information. Okay. You don't want them to just think, oh, that's rolling over and I'm still going to have a zero premium, and they don't pay anything, or Blue Cross doesn't have their payment information, and then it lapses. So those are going to be my priorities, the people close to 400 and the people that have had a zero premium. And then hopefully, I will be able to reach out to the people in between as well. But those would be my two priorities of people you want to be sure you talk to and actively renew those plans and have updated information. All right. And if you're calling the marketplace, this is the number. If you've not been someone's agent of record before, you're going to get that message to initiate a 3-way call with the member on the line. And this is just a link to a call center tip sheet. Also, if you have someone that doesn't speak English, they can help you get a translator. So, read that tip sheet. This is the number you need to call if you are calling into the marketplace. All right. So any more questions? I know we've run over just a little bit, but does anybody have anything else they want me to touch on before we go? All right. Well, thank you. And as Lisa talked about earlier, take care of yourself. Try to get some rest and eat healthy and get some exercise in. And I just hope everyone has a great OEP. We will have another webinar, coming up the third Wednesday of November. And hopefully by then, we will have the plans out. I know we will have them out by then, but maybe we can talk a little bit more about some specific things if you have questions. So thank you for joining me, and always feel free to reach out if you have any questions.